Something in medicine that's really important and that most people or many people really misunderstand is a concept called informed consent. Lots of people have seen the forms that you have to sign when you undergo surgery or some other kind of procedure, and people assume that that's what it's all about. It's just some kind of waiver form so that the hospital protects itself. If anything bad happens to you, well, they disclose it to you, and therefore you have no legal case. That's totally wrong. What informed consent is about is really a right that all patients have, and that is a right just to know the important facts about any kind of medical treatment that they're going to have, so that they can decide, the patient can decide whether or not to undergo that treatment. And that decision can include whether or not to pick this particular doctor or go to some other hospital or doctor. We rely on the disclosures and the communications from the doctors, the nurses, the hospitals to tell us what we need to know so we can make intelligent choices. That's what informed consent is all about. And it's often violated by doctors, hospitals who want a patient's business, and so maybe they won't tell them, hey, I don't have much experience doing what I'm about to propose to do on you. Do you want to go ahead and do it anyway, or would you rather have somebody more experienced for the same price? Now, if somebody learned that, of course, they'd say, hey, I think I'll vote with my feet and try somebody down the road. But a lot of patients just don't think to ask these questions because they just assume that the doctor's going to be totally forthcoming. Actually, the law does put the burden on the doctor, on the hospital, to tell you the important stuff you need to know. It's not a situation where you've got to figure out the right questions to ask. It's their burden to tell you, but it's a misunderstood thing that a lot of people fail to exercise their right to informed consent.